Good afternoon. I'm Alan Unell, and this is Healthcare Reform Advocacy, a series of videos where we discuss problems in the healthcare system and things we can all do to make them better. All the links and references will be in the description area below, together with links to Healthcare Advocacy, our Substack newsletter, which is mostly daily. Okay, today I want to talk about healthcare disinformation. Disinformation is malicious, false rumors, so that's on purpose bad, that have been spreading like wildfire for the past 8 years or more in our country and around the world with dramatic negative effect. Now, of course, we live in a very tightly connected world where we're never very far from the latest rumor or conspiracy theory on social media. What got me started on this topic was I read a particular, it wasn't a rumor, it was bad disinformation about the latest COVID vaccine, which was false, but got picked up all over in the news world. And so I decided to do a program on that. So the Rand Corporation did a study on COVID disinformation campaigns. They examined 240,000 separate internet postings, and they discovered that they were able to detect who was responsible for which kind of disinformation. That's actually pretty impressive. Anyway, the most important finding they had was that both Russia and China promoted very dangerous conspiracy theories about COVID-19 that had a pretty negative impact on global public health, and they really are very serious wrongdoing by these nation states. The conspiracy narratives included the idea that contact tracing is a sinister plot for governments to track their citizens and establish a totalitarian state. Also, unproven drugs like hydroxychloroquine and ivermectin were both effective for treating COVID-19. They are not. The additional part of the rumor was that they were being withheld from the public by a big pharma cabal, and that the danger of COVID-19 was greatly exaggerated by the medical establishment. Lots of these conflict with each other, but they create confusion, and that was the point. Our adversaries have a goal. It is to weaken the US and our allies, and a very effective strategy they have for doing this is to inject lies in our social sphere to make us not trust things around us. And that includes not trusting health professionals, public health, the government, experts, people who studied for decades to learn how to do their job, etc., etc., etc. I'm going to put a link to a news article, a very recent news article done by one of the major networks, showing that people are now not trusting the mumps, measles, and rubella vaccine, and they've been declining on the order of 5% a year. That's a particular problem. I live in the Pacific Northwest with my wife, and we had a measles outbreak here. People may not remember, but measles actually kills children. It is so wrong to not be vaccinating these children against such preventable causes of death, and I think in mumps also sterility. A recent survey of pet owners to amplify this, I couldn't believe this one. 1/2 of all pet owners surveyed were scared to vaccinate their dogs against rabies. As a country, we've just got to get a hold of ourselves. We already know the effect in the US that COVID disinformation had. Hundreds of thousands of us died who did not have to die. The attacks from adversaries are so real, and so are the results. And the results are just devastating, and they don't have to be that way. So what can you do? Okay, forewarned is forearmed. So here's some useful guidance that I found from the Cybersecurity Infrastructure Security Agency. That's a government computer science office, and they look at who's attacking who in the United States, and they provide warnings. and sometimes remediation. So here's one of their publications. There'll be a link for it below, and I'm going to summarize it for you. What you can do. They have two different links. One is just on general misinformation and what to do, and the other is their library of documentation of all kinds of disinformation related to election security and healthcare, a whole bunch of them. And they're worth looking at. Anyway, number one, question the source. Critically evaluate content and its origin to determine whether it's trustworthy. We can all do that. Research the author's credentials. Consider the outlet's agenda, if they have one. Verify any supporting facts. You should investigate the issue. Conduct an unbiased, thorough search into contentious issues by looking at what credible sources are saying and considering other perspectives. Rely on credible sources of information, such as government sites. Think before you link. Slow down. Don't immediately click and share content you see online. Check the facts first. Some of the most damaging disinformation spreads rapidly via shared posts that seek to elicit an emotional reaction that will overpower your critical thinking. Once your emotions kick in, it's hard to think straight. Talk with your social circle calmly. Engage in private, respectful conversations with friends and family when you see them sharing information that looks like disinformation. Be thoughtful what you post on social media. Now, I'm also going to put a link into amazingly enough, there's a class where you can train yourself to fight back against this stuff. It's offered by the World Health Organization, and there's going to be a link to it also in the section below. Anyway, they have a class, it's called Infodemic Management 101. Infodemic is too much information, lots of it false, misleading, and disinformation in the face of a medical catastrophe. Okay, so I'll put a link in there for you. And that's today's message. We all have to protect ourselves, tell the truth, and be sure we're not falling for misleading statements and sharing misleading statements. Okay, like it, share it. I'll also put a link for healthcare advocacy in the description section, and you can subscribe there as well. Put your comments in. I want to hear them. Have a great day.